So we got a patient here, about roughly 6 months ago. He fell off at work, and as a result, he started to have a lot of knee pain, and it would lock up on him. And his left knee got worse, and it was bad enough to the point that he needs surgery on it. And that left knee, he can't even kick with it. So right now we're scanning his spine for any difference in temperature, and we found one at this level over here. And I believe we found another one, tiny one down here. So there's some swelling at this level over here. There's some swelling over here. Let's check these structures. All right, the left side is not moving whatsoever on that sacrum. Left hip is moving fine. Right hip's moving fine. Okay. Do we have some pain over here?
Yeah.
Yeah. What about here? Even more? Yeah, so that's the one we're gonna correct, right there. So we check this right knee over here. Right. So over here, it's just too loose. This one's nice and solid. See, this one's not pivoting well either on that side. So you can see with this patient over here, there are two laparoscopic incisions over here. They operated on this knee, and we also see this swelling all around here, right? And he also complains about pain on that side as well. So the medial meniscus is right here, and we're going to test this knee right now. See, there's too much give on this side over here. That tells us there's something going on with this femur. Pain right there?
Yeah.
Pain over here?
Yeah. So
this is all the swelling that's coming from the joint capsule on the medial side, and part of it's going to be from the medial meniscus as well. So we challenge, test, and the femur is not moving whatsoever. Tibia and fib are moving just fine. So it's the femur on this one, right? There we go. Because before you mentioned about you had a lot of trouble kicking with it. How about now?
¿No siente dolor ahora? No. No. He says no.
No what?
He doesn't feel any pain.
Oh, you don't feel the pain anymore?
No.
When you try to kick it?
Yes.
Hey, I think it's over here. Just a little bit there, right?
Just a little bit in the back. Yeah.
So what we see on this x-ray analysis is for the right knee, what I want to see is parallel lines over here. But there is an increased gap on this side over here. And also with this increasing distance between the tib fib, that tells us that this is an AEX tibia with a side slip on this one. His left knee, the one with the operation over here, it altered what's going on with the medial meniscus as well. But no, that's why we did the structural test, and it reveals that he still has an AIN femur. Let's go address those. Tendon right there? Pain?
Yeah.
Not too much there, right? So that tells us there's a swollen joint capsule over here. So before we correct this, we're gonna pump it up, reduce some of the swelling, so we can have an easier set for this knee. There we go. That did it. Now with AEX tip side slip, with the contact. Right. There we go. And because there's surgery on here, it did alter the biomechanics of this knee here. So we're going to be very gentle on how we set this. Let it go, just relax. There it is.
No mejor lo que estaba. It's much better. Much better. Let's go. No.
Alright, how's the right knee now?
Just being over here like that. Here.
Pero dolor como antes.
Not much, poquito.
He says that's a little bit of pain, not as before.
Right, that's a good start right there.
It's a little bit now.
No, that's a very good start. So here's the thing I want you to do for both your knees.
Yes, okay.
Alright?
Yes. Little bit here.
No, I said that. So this is what your homework. What I want you to do is this. For both your knees, I need you to ice it 20 minutes, 3 times a day. I also recommend go into a bathtub, right? Put some Epsom salt in there, right? Get the swelling out of the way. And as the swelling reduces, you'll notice both your knees, they'll function a lot more easier. Right? So we're all set for today. We'll see you in the next video.